Welcome to the Perinatal Wellbeing Podcast. I'm Christine, your host and certified perinatal mental health professional. This podcast is all about authentic conversations. We want to open up the discussions around perinatal health and well-being, from mood and anxiety disorders to breastfeeding to grief and loss in the perinatal period, and everything in between. While this is not therapy or medical advice, it is the place where we are going to continue to open up the discussion around all things perinatal mental, physical, emotional, and sexual health to help reduce stigma and break down these barriers to support. Welcome, everybody, to today's podcast episode of Perinatal Wellbeing. And I am talking to Elaine, who is a parent with a disability to 2 kids. And so we are going to talk today about her experience of coming into parenting and parenting 2 kids and how her disability has shaped and changed that experience for her. So welcome to the episode, Elaine.
Hi, it's nice to be here. Thank you so much for having me.
No problem. I am so grateful that you reached out and that we connected. And so let's just dive right into it, because I think that, as always on this podcast, we love sharing all different kinds of stories, and everyone's story is important and unique. And so, Elaine, can you tell us a bit about yourself and kind of how you came into parenting?
So, like Christine said, I am a single parent of 2 children. I am also an active volunteer in my community in multiple different ways. I am looking for employment, but because employment is not forthcoming, I've decided to embark on a bunch of different volunteer endeavors instead. So I volunteer for CNIB. I volunteer for my accessible public transit committee in my city here in London. And I also volunteer for the Patient Experience Advisory Council for the London Health Sciences Centre, which encompasses all 3 of our different hospitals here in London. So, like I said, active volunteer in my community, along with being a single parent of 2 children. And I am also totally blind. So that's sort of the disability aspect of it. How I came into parenting. I didn't come to parenting exactly by choice. I was a university student who was working, and I was also taking 4 courses, and I was also volunteering for the Foot Patrol service at our campus, which is a service that allows students to work with other students to help them get home safely at night, usually. But it also encompasses taking students from class to class, because since classes don't end until 10 o'clock and it might get dark by 5:30, some students are a little worried about walking by themselves. So the Foot Patrol service allowed students to work with other students to help them all feel safe. So I was doing all of that. And then there was a big bus strike. It was about 2 months. I was living away from the university and depended exclusively on transit to get to the university. And then also I experienced a major loss in my life in that the person I was seeing on and off for the last 5 years, I can't even remember now, had decided to kick me to the curb. So I was going through a lot of really bad things. I didn't feel very good about myself. I thought that I had lost everything. When you're 22 and you're in that sort of mindset, you believe that you're the center of the world, and sort of things happen around you rather than to you.
Yes,
So
absolutely. Absolutely. Wow. And I can imagine too, even thinking about accessibility and the transportation, like the bus strike, that must have had a really big impact on you.
it was very impactful, because there was no way that I could be on campus when I couldn't be on campus. And back then, they didn't do remote or hybrid classes like COVID, because it wasn't that the option wasn't available. It was just that nobody had fathomed that it needed to be done. So it was sort of, you get yourself to campus. And when I was living in Ottawa, I didn't have a lot of resources available to me. I had a few friends who could drive, but obviously, not every day. And the person who did help me out did not live in the city. So, it was 45 minutes for him to come in and then drive me, for a class that could be an hour and a half or 3 hours. And so it's, trying to make it work. So definitely that was very impactful. So I ended up getting pregnant without realizing it. And I literally came home because what happened to me was literally I burnt out with all the stuff that I was doing. I was working, I was volunteering, I was also commuting back and forth to that person who dumped me. And he lived in Toronto. So I was literally doing quite a lot. And I literally burnt out. And that's basically what happened. Had a sort of a mental breakdown that sort of started with a suicidal episode attempt. And then I basically came home to try to recover. And then I ended up getting pregnant. And I didn't realize I was pregnant. So what happened was it took me about, I would say, a good 6 or 7 months to come out of my sort of huge depressive episode. And so what happened was I literally got kicked out of my faculty in university because they basically said that I had dropped out. And so they, didn't believe that I should continue. So they kicked me out, and I appealed that decision and actually won. And I won my way back into the faculty, and I had geared up for the next year. I had a job at the university. I was going to become a student mentor. And I literally had everything in place. I had my courses selected. I had introduced myself to my professors. I had done all of this and then came home for a doctor's appointment. And I had said to my doctor, I'm struggling with some severe, severe migraines. Now, I've been diagnosed with migraines since I was a child, but these were getting worse and worse and worse. And so she looks at me and she says, your uterus is right up here. And she points, basically between my ribs. So she says, your uterus is up to here. You're 7 months pregnant. And I said, okay. And then, of course, she goes and gets the Doppler and then checks for the fetal heartbeat. And, there's a heartbeat in there. And so it's funny because before I had seen the doctor, I was complaining of things like feeling like I was being kicked from inside, and
Right.
I was being kicked from inside.
Yes. Oh my gosh, Elaine. I have to ask you, sorry to interrupt you, Elaine. I have to ask you, when the doctor said to you, do you remember in that room, like what you felt like? Like, what were the thoughts, or emotionally, like how did you react?
Well, I think in my head, I was sort of numbed by it. It was sort of like, it was very sobering. It was sort of like, I think part of me knew, like part of me had known and had been denying it and just sort of, and then she asked me obviously the questions like, didn't you get your periods? What didn't you not notice? How did you not realize? And I said, well, I thought I was just under a lot of stress. And I thought, maybe I, I just, maybe I had missed them, like denial. I was really good at fooling myself into thinking that nothing was wrong.
Right. And
And then
when
also she,
Yeah.
sorry.
Oh, sorry, Elaine. I was just going to say, and when we're, if we're experiencing like extreme burnout or a deep depression, or, any level of depression, we also become disconnected from our body.
Yep,
Right. And so,
very much.
being in tune with those signs and symptoms also can be a bit harder because we're just not as connected to our body. We're not as present. Right.
Well, and also with the depression, I was doing more, not recreational drugs, but I was taking more, medication than I was over medicating myself with alcohol and with, over the counter drugs or with narcotics that I used for pain control. So definitely I was dabbling in that sort of thing. And so I thought that the vomiting related to the morning sickness was actually that, just reactions to the drugs. And yeah, so like I said, very, very much in denial, but definitely I think I was a little shocked. I was a little bit sort of odd. And then I was a little bit already, when I hear news, natural instinct is to automatically start planning and start thinking. So basically, one part of my brain was like, yep, I knew this was coming. Another part was like, oh my goodness, what am I going to do? And then the other part was like, well, so I guess you got to figure out what you're going to do. And I think what my doctor said next was really the deciding factor on which sort of form of care I was going to go to. She did a wonderful job of getting me into an ultrasound, because obviously, by then I hadn't had any ultrasounds, and 7 months along, you want to know that everything is okay. So the cool thing is my doctor is amazing. I mean, she's an extremely competent medical professional, and so she managed to get me in within the next week, and the ultrasounds were booking, a couple of months in advance. So it was pretty amazing that she was able to get me in that quickly. But what she said next, though, really clinched it for me. She made a very ignorant comment of, so who's going to parent this child, your father or you? And then she also made a comment of, so how are you going to know if you're changing your baby on the table and your baby starts to roll? How are you going to realize that your baby's going to fall off the table? How are you going to keep them safe? And my knee-jerk reaction to her was to be very annoyed, but at the same time, she had never encountered, like, I think I'm her only blind patient.
Right.
And I definitely don't think she had ever encountered someone who had a disability like mine and was a parent. So to give her the benefit of the doubt now in hindsight is a lot easier. But back in the moment, I was angry that she had made that comment, and I just couldn't believe it. And it just shows the bias that medical professionals have, when it comes to what our assumptions are going to be about a parent, especially if we know that they have a disability and we know them, intimately from a charting point of view, even though she didn't know me at all from a person point of view, because she's seen me, as a patient over the years, but it's not like she knew everything that was going on in my life, or what I was able to accomplish.
Yeah, I was going to say exactly. And I'm guessing also, but please, Claire, let me know if I'm wrong, but was that the first encounter you'd ever had with someone judging you or, being basically like inappropriate or, making unfair assumptions about your abilities?
Oh, never. I mean, we people who are disabled are misjudged all the time, but it was the first time I'd ever been confronted in such a way, in such a sort of very blunt but very angry sort of way of, just basically automatically assuming that I would shirk this parenting off on someone else, because I wouldn't be able to do it because of my disability. And then asking the dumb question about the whole changing thing. And my response to her was basically, well, I'll change my baby on the floor. And interestingly enough, that is what I did, not all the time, but when my baby got old enough and started moving around, that is exactly what I did. And especially when they got into the toddler years. So again, I'm able to come up with these sorts of things, but I was so angry. And so that anger led me to think about the parenting class I had taken in high school. And thankfully, the teacher at the time had done an amazing job of enlightening us, as to our options. And one of the things she did was bring in midwives from McMaster University, because the school was in Brantford. So McMaster's not too far away. And so she brought in midwifery students and midwives, to talk about midwifery and about it being an option for pregnant women. So literally, the first thing I did when I got home was Googled midwifery Ottawa, and literally found myself, figured out where I was going to have my baby and who I should contact. And I literally contacted a few different places. And it is unusual that I would come in so late, because normally with midwives, they generally follow a pregnancy from almost from conception to birth and postpartum. But thankfully, I was in a position where, the midwifery collective that I called, they literally had a midwife who was still looking for patients and who was relatively new to the practice. So it worked out really well because they had someone for me. And so I literally started getting followed by a midwife there, and she was amazing. Midwives in general are an amazing group of people. The one thing I will say that is really cool is, unlike my doctor, they didn't see me as disabled. They just saw me as another pregnant woman. And so my needs were just the needs of another pregnant woman. And if I had to be accommodated in some little way, they would do it. So instead of, me reading the telling them what color the stick is turning or things like that, she would do it. Things like that, or reading the scale, or, that sort of thing. It was very simple for her to adapt and sort of just.
Yeah. And I think even that, they had to start somewhere, like learn somewhere, right? But even it's like the asking the questions of what do you need? Correct me if I'm wrong, but, asking like what accommodations do you need if they don't know, or they don't, they've never worked with someone, for example, who's blind, but also instead of assuming that you can't.
That's right. We love that. We absolutely love that. Assuming, the asking the questions and making the accommodations based on talking with the person with the disability rather than assuming what they can't do.
Right. Because also everyone's different. It's not like, everyone who's blind, does things in the same way. Everyone's individual and needs their own, support.
And I think that's why the midwives were so great and didn't see me as a disabled woman and just saw me as a pregnant woman, because like they, obviously every pregnancy is different and every woman's experience of pregnancy is different. So how is that much different from how people experience disability? So they, like I said, she was absolutely amazing, to the point that, they told my blood pressure was something they needed to keep an eye on. So she told me about what I should watch for. And I remember going to the hospital, vomiting like crazy. And it was actually a reaction to the fact that I hadn't taken one of my medications that I needed to take, but I didn't know that at the time. But she'd gone with me, and she's holding my hair while I'm vomiting, and she's being just so supportive. And but that had nothing to do with blindness. That was just being a midwife and being there for their patient. So that's the wonderful thing about midwifery. I definitely recommend it to anybody going through pregnancy, and I definitely especially recommend it to people who are disabled, because it's just that support that you need. You can't call your doctor at 3 a.m. when you're going through symptoms and not knowing what they should be, or when you're dealing with a postpartum baby who's crying and keeping you up and you're crying your eyes out. You can't call your doctor at 3 a.m, but you can call your midwife. And that's the difference. And that was the other reason I chose that method of care, was also because I knew that postpartum care was included in their care. And OB is wonderful. They are great. And I've had experiences with both, because my second pregnancy was actually in shared care. So I had a midwife and an obstetrician. But at the same time, the obstetrician is not the one who's going to follow you through the breastfeeding journey and through your very, very vulnerable postpartum journey, when you're worried about baby losing weight and gaining weight, and baby starting to develop those milestones, lifting their head, smiling, et cetera, et cetera. And also, the one thing about midwives that are wonderful too is they can sometimes accommodate, and usually will, especially when transportation is a factor. Now, I will say that things were different from my first to my second. My first child, I didn't get to experience the full midwife accommodations, because I left very soon after my daughter was born. Like I moved back to London, where I had support. So unfortunately, she had to discharge me, and it wasn't like she could discharge me into the care of another midwife, because they wouldn't know me, and it wasn't like that. So she discharged me back into the care of my family doctor. But my second child I had in London, and got to have the midwife experience all the way through the pregnancy and postpartum. And when I say that they come to your house, I do mean that. Like literally, I remember in Ottawa when I was in labor, my midwife coming and checking me and telling me, don't bother going to the hospital, and checking my blood pressure, my vitals, checking the baby, checking how far I was dilated, all of that stuff at home without having to go anywhere or do anything. And then when I was having my second child, my midwife also came to my home to do the visits afterwards, to avoid me having to go out in the winter with a new baby and trying to get transportation to the clinics and stuff like that. So again, they are very accommodating that way, and they will do their best to help you in whatever way that you need. So obviously, in other parents, that isn't necessarily a need, is the transportation aspect. But they will, and they also will gauge it based on your own mental health at the time too. They're not, they're not rigid in the sense that no, you must go to your clinic appointments, but if you said to them, I can't do it, I'm not able to, they would say totally, well, let's see if we can get someone out to see you. So that's how accommodating they are. So again, I recommend midwifery to everybody. They really help to assuage those fears of, well, who do I call when baby is, crying all night, or who do I call if baby doesn't look right? And my daughter ended up having a little bit of jaundice because I came home with her literally a day after she was born because we were both fine. She was healthy, I was healthy. So it was just me and my roommate. My dad had left, and I was trying to feed my baby, and she just seemed really lethargic. She wasn't crying much. She wasn't really soiling much. It was very concerning, and I'm a brand new parent, so I didn't know. So I called my midwife and I said, my daughter's doing this and this. And she said, do you feel like you need to go to the hospital? And I said, yeah, I do. I don't, this doesn't feel right. And she said, well, go with it. She said, I'll call them and let them know that you're coming. And she did. And turns out that she had a little bit of jaundice. She was only under the lights for like, I think an hour maybe, but it was just a touch of jaundice. And then they also found out that she had a UTI. And so, definitely the midwives go with, they don't question your mother's intuition when you really don't feel right or sound right. They don't sort of go, well, it's probably just this. Why don't you just wait and see? Or if they say wait and see, it's so wait and see and call me in 2 hours. They give you very finite and very tangible timelines that it's really easy to comply with and give you structure. And in that moment when you're really uncertain, structure is definitely what you need.
Yes. When, especially as a new parent, right? And it's the first time you've encountered these things, like, their first, like if they're jaundice, or the first time that maybe they're not, like you said, going to the bathroom enough, or, what, all that stuff, or the first time they have a cold, or, stuff like that. And it's like, oh my gosh, what do I do? Right.
Yep. And the really interesting part too was that my daughter was actually born during the H1N1 epidemic.
Wow. Right.
And the other thing that's really interesting is I contracted a flu just before she was born. So I was really sick through the whole thing. Like I was very, very sick. Like I didn't have H1N1, but I did have a very bad flu. So again, normal medical professionals, because I do remember taking her to a walk-in and asking, a walk-in doctor about her and if she was okay, and because I was worried about H1N1 too, and I didn't want her to get it, and I was sick. And they tried to tell me, you should be careful breastfeeding your child, and you should be careful touching your child. And they had tried to convince me to wear gloves and that I should be careful about touching her and holding her to me and things like that, which is just totally counterproductive to the way that a newborn bonds with their mom, because they were, erring on the side of caution. But definitely no, the midwives were not on board with that. They said that's obviously not going to work for your situation, and obviously not gonna they were much more open to the idea that the baby would be more resilient and more likely to thrive if it had proper contact with me rather than me curtailing the contact. But definitely me being sick did add an interesting barrier with me going to the hospital to see her when she was in for the jaundice and when she was in for the UTI, because she actually did have to be on antibiotics and stuff, and had to be there for a couple of days. But it gave me two things I was able to do. One, I was able to go home and rest a little bit, which was nice, because of how sick I was. And then two, it made me conscious of the idea that, when you're in a room with other people, you have to realize that it's beneficial to be masked. So I started understanding those COVID precautions long before COVID was even a thing.
Right.
Because obviously, it wouldn't be fair to another new mom and their baby if they got sick because of me. So,
right. And Elaine, when you, brought your first baby home, and you moved back home to be close to your supports, How the people that were in your circle, friends or family members, were they supportive of you? Did any of them ask you, questions like, well, how are you going to change your baby? Like, what was that experience like for you?
Well, thankfully, my dad is a wonderful, wonderful man and doesn't really. He pretty much just goes with it, and he doesn't. He would never ask something so horrible. Not only because he doesn't believe that it's possible, but because he just it isn't in him to ask those kinds of questions. He sort of would let me tell him what I needed and go with that. And so I would say that my dad was very supportive, but I would say that my brothers were less supportive. It's kind of interesting how that differs in families. But no, my dad definitely was very supportive, very much, just what do you need? And when we drove home, we literally, like, my dad, he's so great that he pretty much left it to me to really advocate for things. Like I remember coming home with him because it's about an 8 hour drive home from Ottawa, right, to London. And I remember coming home with him, and we brought home my cat and we brought home my baby at the
Right.
same time.
Yeah.
And so I remember, it's the first time I went to a service station to change a baby, and it's the first time I've ever done that in my life.
Right.
And of course, he couldn't come with me into the bathroom and show me where the change table was. And I had just learned how to change her. And I mean, it's all so new. And I remember being terrified, but I don't really think that differs from a lot of experiences of new parents. Even when they have their moms right over their shoulder, or their sisters, or their friends who are right there with them, I still don't think it really changes that much. But for me, definitely, I had the guide dog, I had the baby.
Yeah, that's a
I'm in
lot.
this McDonald's, and I'm trying to figure out, where's the garbage, and how to keep the baby still, and how am I going to change it in this sort of travel place where I don't have my setup the way that I want it to be, and et cetera, et cetera. But
Um,
obviously I made it through. I also remember pumping in the car.
yes. Oh,
On the
God.
way home.
Yep.
And I remember, feeding her in the car seat, because I obviously couldn't breastfeed while we're moving and things like that. So, but again, my dad very, very supportive and great. Just pretty much, tell me what you need, and he put up with me. But he also didn't assume that I needed, like, there were times where I swore, because he used to visit his wife, because his wife and him didn't live together at the time. So he used to go and visit her. And so he left me home alone with the baby pretty soon after we got home. I'm still scared, bathing her for the first time. I remember bathing her, and she was so slippery, and I'm all by myself, and I'm just like, oh my goodness, this is a lot. But he would have come back if I'd called him and said, look, I'm really in over my head here. But I think he left because he figured she can do it. She'll let me know. So,
Right. Right. Yeah. You'll tell me if you need me.
yeah.
Yeah. Oh my gosh. And Elaine, it's funny that, my oldest is 16, but when you talk about those stories, it just brings me right back. Like I remember the first time changing my baby in, in a public place, and I'm like sweating, and where's the thing? And oh my God, is it filthy? And like, and oh my God, did I forget the wipes? Or,
Yep.
and oh my gosh, yeah, car rides and they just won't stop screaming, or I don't know what's going
Yep.
on, and the bath. Oh my gosh, I remember the nurse helping us bath our son the first time when we had him, and then bring him home, and then like the next day or whatever going to bath him, and I'm like, oh my God, where's the nurse? Like, how are
Yep.
we gonna do this by ourselves? Like you said, they're so slippery.
They literally are. It's, oh my goodness, they just slip. And so, and I'm a bit of a minimalist parent in the sense that I didn't have a ton of the things that you know the baby bathtub and this and this. And I do remember, I did have a baby bathtub, but I don't think I used it until after I realized how slippery she was. Because in my mind, I went, why do I need the baby bathtub? I can just put her in the tub with a little bit of water, and make sure that she's on her back. And it's so funny because now I realize, the reason that you do have the little baby bathtub with the hammock is actually because it helps keep them in one position, and it helps them from slipping. It keeps them from slipping, and that's what I realized after. And I went, okay, I guess that is a reason to use that. So,
Elaine, I will say I did the exact same thing. I was like, we'll just put him in the bathtub, like with a
yep. Why
water.
do we need
Like,
this thing?
yeah.
Yep.
And then same thing, bathroom. I'm like, oh, right. And also because my back was like broken from bending over all the time.
Yep.
So I was like, oh,
Yep.
I'm gonna bust out that bathtub.
That bathtub. Yep. No, it makes it so much easier, and that's exactly why they exist. But yeah, in my minimalist view, I was just like, why do I need to buy this thing? Like, it's just a bathtub. They're only going to use it for this long, right? So, and you know what's funny though is as you get experienced in things, things change. So my son, I didn't use a baby bathtub with him at all, but it was only because I knew what I was doing this time. And basically I would bathe him and then I would drain the tub and then I'd basically just wrap the towel around him and then pull him up so then he didn't slip out of my arms as I'm trying to, hold him. But again, it's only because of the experience that I had. Like it's amazing how from one child to another things change. From with my son's pregnancy, I knew pretty much right from week 4 that I was pregnant with him. But again, I was in a much different place. I was in a much better place mentally, and I was able to. I knew it. I noticed exactly when I missed my first period and went, okay, I'm probably pregnant.
Right,
So,
right. And it sounds like you were, like you said, you were feel like you were doing better, you were in a better place. So it sounds like too, like you could be more in tune to that. Whereas the first time around, it's like having depression and deep burnout and all those things, like it makes it really hard, sometimes impossible to be in tune to the body and to what's going on. And, the thought of having a baby, right? Like you said, there was some denial there, right? Like, this is too much. I can't deal with this, right?
well, and the other thing about my second child coming along though, again, is that interestingly enough, so I wasn't in a depression when I got pregnant with him, but I soon was in a very deep depression during the pregnancy to the point that I almost tried to commit suicide while pregnant. And when I told my psychiatrist that, he basically said that is a huge red flag. He said we need to get you the right supports. And he said, most pregnant women, that's the one time that suicidal ideation doesn't come into play. So he said, huge red flag. And he'd done research into prenatal mental health. And so definitely he had some statistics to back him up. And he just said that's not okay. So, but they did do like with my second child, I even saw that a genetic counselor who talked about things like what medications, what impacts they might have on fetal development, which was really cool to help weigh the pros and cons of what should I be taking and what should I not be taking. Because obviously, depression meds are one of those meds that during pregnancy that you have to talk about with your healthcare provider to weigh the pros and cons of should I be taking them or should I not be taking them. And of course, if the health of the mother outweighs the impact of not taking them, then that your healthcare provider will usually err on the side of yes, there could be some complications with fetal development or there are things that we should watch for, but no, you should not stop taking them.
Right. Yeah. And there's a lot of medications now, especially antidepressants, that are safe during pregnancy and even during nursing afterwards. And so definitely talking to your doctor about that, getting support around that. Because unfortunately, I see so many people and clients of mine who, let's say they already, they live with anxiety or depression. That's kind of a part that they have that is kind of lifelong. And then they, start family planning or they get pregnant and then they're taken off their medication really abruptly. And that's never great. And so, and a lot of times, like, it's not even necessary. So it's so important to have that conversation and like what is safe and just like you said, right? Getting that informed, like all that information so you can make an informed decision.
Exactly. I know it's terrifying because people who have mental illness start to worry, can I actually carry a baby to term and can I do this based on because some healthcare providers will let their biases show and say, no, you should not have any medication while you're pregnant. And yet forgetting that the medication helps keep them stable. And obviously the time that you'd want to be most stable is when you're trying to bring another life into the world. So
Definitely. It's already destabilizing enough, isn't it?
yeah, for
Yeah.
sure.
And so how,
Unfortunately, no, because the depression became stable, in the sense that, I wasn't trying to commit suicide and I wasn't, doing any destructive harm. I definitely didn't want to do any destructive harm to the baby. So I wasn't drinking, I wasn't smoking, I wasn't doing anything like that. But my well-being was not in a good place. I worried because in my second pregnancy, I felt a lot more alone. My first pregnancy, I lived with good people, my roommate and best friend at the time. And so there was a lot more support there. My second pregnancy, I was on my own in the sense that I was living with my daughter, and that was it. And I mean, my dad was supportive in the sense that he drove me to my midwifery appointments, and I had my midwifery team and stuff. But as far as feeling supported by the father, it wasn't like I had someone I could gripe to about, how crappy I was feeling, or how he made me feel so bloated I couldn't eat, and things like that. Just that sort of thing that you get from having a supportive person in your life who's willing to help take on that burden of, going through the pregnancy with you. Because by then my best friend had moved to Alberta, so we weren't even in the same zip code. And yeah, so and obviously talking to her was not the same as, being there and seeing me every day and helping me. I will say my best friend was instrumental in being there for both births that I had. She actually flew all the way from Alberta home to make sure she was there for my son's birth. Actually, he literally decided to come the day that she was flying home, so it was kind of funny. 8 o'clock in the morning, my water started to break, and that was when she was going to be getting on a plane, and so she came in around 5, and then he was born around 9:30. So
wow,
yeah,
just in
she
the nick
made it
of time.
just in time. Yeah.
Wow. And so what was that like for you, being pregnant and welcoming another baby when you already have one at home? What was that like for you?
It was difficult. I mean, my daughter was all about the idea of having a little brother or sister. She was pretty supportive of it. Of course, now that he's here, she's definitely, I always joke about it. I always say, "Do you want another brother or sister?" She said, "Not, I'm not falling for that again."
Right. Yeah.
But no, it was difficult just because I still had to take care of her, and I needed someone to take care of me. And obviously that was not happening. And I, at the time, I also had to, because I ran the household. I had two dogs, I had two cats, I had, my one child. We probably had hamsters at the time.
Right.
So lots of responsibilities and still being pregnant. And um definitely it was exhausting. Like, I just remember being so tired and so sick all the time. The pregnancy was uncomplicated in the sense that there was not too much excitement, except I did have what they call hydramnios, which is the buildup of excess amniotic fluid in the amniotic sac. And unfortunately there's no way to drain that. It just can build up and build up. As long as it's not suffocating the baby, it's fine. Anyways, I had that. So it got to the point where literally I could eat or I could drink, but I couldn't do both. So it was like pick having half a sandwich or having a bottle of water, and that's what I could do. And so it was hard. And having her at home, she definitely, and at the time she would have been going to school, and school is something that she really struggles with, in the sense that she really doesn't like it. She's not motivated to go. My daughter also has an intellectual disability, so it makes her a little different, and it makes reading and writing and arithmetic and language very difficult for her.
Mhm.
And also she's very sweet and gentle and tends to get bullied by her peers,
Mm,
especially because she's different.
right.
So again, having because 2019, so she would have been pretty much almost 10. and yeah, going through that was definitely difficult.
Right. And 2019, and then a year later,
The
we have
pandemic hits, yeah.
the pandemic hits. And then you talked about, during pregnancy and experiencing that depression and potentially related to that isolation you were feeling. And we saw those numbers in terms of mental health, mental illness, depression, anxiety coming in and really spiking for pregnant people during the pandemic. What was that like for you, having two little ones, two kids, a baby, like 1 year old maybe, when the pandemic hit? What was that like for you?
Well, thankfully, because I'd been through this process before, I had worked very hard at being as proactive as possible, to get the support I needed after he was born. So he was in daycare, I believe, pretty much within the year. So thankfully, that was okay. And in the sense of the pandemic, I was able to do online schooling with my daughter, which was exhausting. But it was, I don't know. It's actually, to be honest, it's a blur. I don't even remember anymore. I just remember very much that I had done my best to try to be proactive in supporting myself. And I say this because I've also been, it's not something I mentioned, but it's something I will mention. My daughter and I, when she was about 20 months, the roommate who had been extremely supportive and my best friend, we had a falling out, and it was my fault. I was expecting way too much from her because my mental health had taken a huge turn for the worse, postpartum. And it wasn't postpartum psychosis, but it was almost to that point. And it was bad. So I had been using any resource I could to get respite or to get time away from her, because I knew that I wasn't able to parent her properly. But I was leaning on my roommate to the point that, her life was impacted in that she was a college student trying to do her work and trying to get through what she needed to get through. And I'm expecting her to parent this baby at the same time. So she eventually decided that it was too much and she needed to leave. And she was right, because I needed to grow up. And so she did. And obviously, that was a huge loss for me. But it forced me into a situation where Children's Aid got involved. And they allowed me to put my daughter into a temporary care agreement for almost a year while I got my mental health back on track. Because I said, basically, look, she's not being neglected. She's not being anything is no nothing bad is happening to her, but something bad is going to happen to one of us if she stays with me. And so they accepted that and allowed it to be. Now, I will say that they were extremely supportive in the sense that my case was very unique and they understood they were taking a prophylactic approach. The idea of, trying to prevent something bad from happening rather than allowing it to happen. But they definitely were not that way the second time around. And it was because of cuts. And I say that because when I was going through the newborn stage with my son, and I had my daughter at home too, I was struggling and I was starting to feel again like I felt when my daughter went, and I was, exhausted. He's crying and I'm just want to sleep. I'm just not there. So I tried to ask for help, and basically they said, well, is he being fed? Is he being clothed? Is he being changed? Are you drinking? Or, any of those questions, safety concerns. And I said, no, he's not, but I don't want him to get there. And they said, well, there's nothing we can do for you. I'm sorry. We have to come in when something bad has happened. And I said, okay, well, that's great. Now, it wasn't them who hooked me up with the resource that I also turn to now. It was actually another resource in my community that helped me, and it's called Safe Families Canada, and they're basically it was a program started in Chicago, I think, in the States. And their role is supposed to be to help try to prevent children from ending up in foster care.
Okay.
So they're actually a church-based organization. That's where they initially started. But it isn't, it's what helps them get sponsorship and whatnot, but it isn't what guides them. And they actually have different what they call host homes, And so, like Children's Aid, they are vetted the same way with the criminal background checks and the home inspections and such. But they will take in a child for, a night or a couple of nights or as long as they can with their family needs, but to help the family in need as well. And this organization, they do primarily help people like myself who are single parents and have no other resources.
Right. Okay. Wow. I'm going to look them up, and of course, anytime anything we mention in the show, in terms of supports, I always link in the show notes as well. So I will do that. And so if anyone's interested in checking them out, check out the show notes. And so it sounds like they were able then to support you.
They were. Not only were they able to, take him and give me a little bit of respite here and there, but they actually had someone who helped come in and just hold him for a couple of hours while I did tasks around the house, whether it was cooking or cleaning or self-care tasks, which was very helpful as well. And these are just people helping people. They're not being paid to do it. They're not, there's no motivation other than the fact that these people care about their community and want to help the people in it. And they've also been really helpful in other resources. Like we had a bed bug infestation not too long ago, which was horrible. And we needed help packing up our house basically so that it could be cleaned properly and deal with the infestation. So I reached out to Safe Families because I needed help. And basically, they hooked us up with a family who was willing to help. And we've also become friends because of it. And so like I said, it's people helping people, which
Yeah.
is really great.
Absolutely. Absolutely. So kind of going back, if that's okay, you were talking about your eldest, your daughter, and her challenges at school and her having an intellectual disability. How do you find, being a parent with a disability that shapes how you support your child with a disability?
I guess I try to impart to her that because she worries like she worries that she's not the same as her peers and she worries that she's not good at anything and she worries that things are too difficult for her or that no one's going to accept her, and I have to try to remind her that that's not true and that she shouldn't change. And she's become part of the LGBTQ2SL community, which is great. And that's, and also I've encouraged her through that in the sense that I don't force her into a gender construction of my own. It's something that she's forged for herself.
Yep.
And so she definitely, like, I try, because she can see that I'm disabled but I'm still able to do this.
Hmm.
I try to remind her that that's should be a source of inspiration, and the idea that there are things that she's going to be able to, she's not going to be an academic and write, papers, but
Hmm.
there's no reason that she can't support her other creative endeavors like photography or she loves animals. And like when I mean loves animals, like she loves animals.
Yeah.
And there's no reason that she couldn't be, part of a rescue or helping to socialize animals, etc. There's lots of different little niche jobs that don't necessarily require the academic high school diploma, the university degree, et cetera, et cetera.
Yeah.
But the problem with that, unfortunately, is it's like a double-edged sword, because at the same time, she asked me the other day, she said, if life is so short, why do we waste time doing things that we don't like? And she, for a
How
13-year-old, it's
insightful.
such an angsty, insightful question. And it was
Yes.
sort of like, and she asked it because our battle is obviously her going to school and this huge emphasis on the fact that she should be going to school and she needs to go to school.
Right.
And so she asked me that question. I basically told her she is right. She's absolutely right.
Yeah.
But I said, you have to try to look at things in the bigger picture.
Mm.
And I said, unfortunately, I know you don't see it right now, but the things that you learn at school will hopefully help to prepare you for the rest of life beyond school.
Right.
And like, because she is so right. Why do we have to waste time on things that we don't like?
Right.
But see, and it's so tough for me because school for me was something I loved and something I miss. I love the structure. I love the sort of the gratification of being told that I'm doing well by other people, that sort of constant reassurance, where of course for her none of that is a factor. She feels like she isn't being recognized for things that she's doing. It's not something she enjoys. It's not something she looks forward to. And she doesn't enjoy that kind of structure. So it's tough for me to try to impart that school is important when she doesn't view it as important. And the really frustrating part is like her grandparents. My dad went to school and did college. So he went to do post-secondary for art. But his wife, who's her grandma, who's very close to her, didn't really go too far with the education. I think she got her high school and that was about it. And she tries to tell Melody all the time that you don't want to be like me. You don't, you want to get a better job than me. And I think, Mel is sort of in the idea that it doesn't matter. She doesn't care as long as she could get a job. And so it's really frustrating trying to impart the idea that school is important and you should do it. And because, yeah. And I personally don't believe the school system is right for her. And if I had had the ability, I would have homeschooled her. But unfortunately, I don't have the patience and wherewithal to be able to teach my own children. I can teach other people's children and I can teach other people, but I do not have the patience and the ability to separate myself from what I expect them to do versus what the curriculum expects them to do.
Right. Right. And it's different, like, which I learned during the pandemic, right? Like the whole notion of homeschooling, which by the way, I didn't do anything. My kids, only one of my kids like did his own stuff. God love him during the pandemic, but the other two did nothing for 6 months at a time. And I felt terrible, but also like there's no way. And I think teaching a kid that's not your kid, very hard. And, I respect teachers so much, but parenting and teaching at the same time, like, I just feel like they don't mix very well.
Yeah, I don't know how people do it. I literally am friends with a person who does homeschool, and she's homeschooled her children up to the point where they decide whether they want to go to high school or public school or whatever. But she's done, she homeschools her kids up to that point if they so choose. And I don't know how she does it. I really don't. And she's got 4 kids and she's homeschooled. I know she's homeschooled all of them up until a certain point. And I know 2 of them have decided to go off and be a part of like regular school, like public schools. And then I know one of them is working and obviously they're successful, but I can't imagine how she did it. So I definitely um, don't have that in me. And unfortunately, the school system is not right for a child like mine because she technically should be in a special education type class. But unfortunately, she doesn't qualify because she's too high functioning. And I really think she would be better off in a class that helped to try to work on teaching her the practical skills that she's going to need for life. So the ability of keeping a house and keeping budgeting and things like that, rather than what they're teaching her at school. And I know they do that, but not in a direct way. It's always a sort of a roundabout way. You have these word problems and you have these scenarios, but they're not actually a practical way, as far as I'm concerned. And definitely for her, it would be a lot more beneficial to her if, say, her schooling was, being in a house and learning to take care of it. How do you grocery shop for the house? How do you all of the skills that they need, rather than let's focus on pointillism in art and how do we draw a picture with different points,
Right.
things like that. And that's what I mean is I don't think the school system was ever really designed for somebody like her. She really is unique. And I know a lot of children probably fall into that category.
Yes.
And it's unfortunate that because of the way the funding has gone, that a higher functioning spec ed class doesn't exist. And I really think it should. So it's frustrating that there's no way in the public system for every child to fit. And what's funny is that in the survey that I take every year with the board or with the school, it's called Every Child Belongs. And it's like, well, okay, if every child belongs, then why isn't there different levels of education for the children that don't belong in the sort of old sort of idea system of passive learning, where your teacher gives you instructions and you read from a book and you do exercises to demonstrate your learning.
Right.
That's not the way my child learns at
Right.
all.
And it's not the way a lot of children learn, a couple of mine included. And it's so tough. And like my son, two out of three of my kids have ADHD, and I do too. And so I find that I'm also kind of more accepting, I think, than sometimes either my husband or their grandparents, like where they're like, you just have to do it. Like, just go to school and just listen and just like, be good, follow the rules and do your homework. And I think because I have ADHD, that I'm also able to understand, like, it's not that easy. It actually is so hard to do those things, but people don't get it, And so I think that helps me relate to them.
And I think I tried to relate that to my daughter. I mean, the other day she struggled, to the point she had a really bad morning, really, really struggled, and she ended up coming home. But she tried, and that's all I asked of her. And she ended up coming home before she even got to school. Like, she basically took one bus and said, Mom, I don't want to do this. I want to come home. And I wasn't going to be, people think that I'm too lenient on her, because I allow her to not go.
Right.
But I don't know how to reconcile the idea of school being important, but me not liking the schooling that she's getting.
Yeah.
And sort of, I don't know how to reconcile those two. And I definitely know that I'm not consistent enough in my messaging to her, and it's not fair, but I don't know what to do, especially in this school system where literally, she's as low as you can go as away from the academics, because in the high school curriculum they do the locally developed, or they do academic applied, etc. And she's doing the locally developed. But the other thing that really frustrates me is that, so in public school they have an education plan, an IEP, which I had, which is supposed to tell them about what accommodations the student needs, but they will actually scale a grade. So what they'll do is, so if she's in grade 8, say, and she's learning at a grade 2 level, they will scale the curriculum down to that level so that she can be successful. But in high school, they don't do that anymore. They're not allowed to modify the curriculum that way. So my question is, what is the point of an IEP if you're not going to accommodate the student? Because they're supposed to follow the accommodations, but what if the accommodation is that the curriculum be brought down to that level? And that's what really annoys me. And I think what really frustrates me as a parent, and especially as a disabled parent, is how much advocacy I have to do for myself and then for my children, to the point that, I spend hours sending emails and going back and forth with the teachers and the principals, trying to impart to them the accommodations that I need to be a part of my children's learning.
Yes.
And that's the really frustrating part, because some teachers are really good about it and then others are not so good. And then I feel bad because I feel like I have to put a burden on the teachers themselves, who already have enough. But at the same time, part of it to me is, this is your job.
Mm-hmm.
So yes, I'm a unique parent and I need all my communications, over email or by phone, rather than me going to a website that's not accessible to learn about their class. So that is one of the big struggles for me, is trying to impart the accommodations that I need and then trying to advocate for the accommodations that my children need.
Right. That's like that added level, right? Because I think about, advocating for my children with ADHD, and I hear you about the IEP, about advocating for our kids when they get to high school. It is a whole other level. And yeah, I said the same thing. Like, what, like, he's had an IEP since grade 2, and here we are, and he's not succeeding. Like, what is happening? Right.
Yep. And it's because they aren't modifying, they can't modify the curriculum. So it's like, but if you can't modify the curriculum, what's the point of an IEP? Because that was the question I asked the LST. Was I said, so what's the point of an IEP then? And he said, well, no, you should keep the IEP because it, keeps the accommodations there. And I'm like, but what accommodations? What accommodations if you're not accommodating? So again, I have some work to do, but like that's the frustrating thing of being a parent is I always feel like I have work to do and I always feel like I could do more, but there's times where I just burn out. Like where literally I'm just like, you know what, I can't do this right now.
Yeah.
And so I do find that sometimes I'm not always consistent about, jumping down a teacher's throat to make sure I know what's going on with the kids.
Yeah.
And I definitely know that's one of my weaknesses, but it's a struggle because even though I'm not working, the other endeavors I'm pursuing are still quite stuff that my issue is I'm not good at succeeding in a mediocre way. I put my all into everything I do. Unfortunately, that sometimes means that I feel like I'm really overextended because if I have to put my all into transit and then I have to put my all into the LHSC and then I have to go and advocate for my kids and try to keep on top of everything, sometimes stuff gets lax. So sometimes I feel like when I go for the advocating for my kids, I go on sort of a tangent where one week I'll be really microscopic, like micromanaging of what's going on. Like I'll be really in touch with the teachers. And then another week will go by and I'll be doing something else. Like my focus will be somewhere else. And it's not that I don't care. It's just that I literally don't have the energy sometimes at the end of the day to make sure to do everything that I would like to be able to do.
And like you said, right, like there are these other layers that are coming in that not every parent is experiencing. Like I'm advocating for my kids, but then I don't have that layer of advocating for myself with the teachers, right? And I'm thinking of just, advocating for my kid in high school has been felt like another job, like a part-time job, sometimes
It is.
full-time, right? Yeah.
Especially because it's almost like they're in university because you're dealing with 4 or 5 different teachers and then you're dealing with their guidance counselor and then you're dealing with the LSTs and then you're dealing with the principal. Like it's just like it's this nonstop hoop jumping and with all these people who may or may not have actual contact with your child. Like I'm also trying to petition the board right now to do psychometric testing on my one child because they had it done when she was in about grade 2. And obviously it didn't, the reason that I'm pushing for it is because if she gets an actual diagnosis of an intellectual disability based on the testing, it would provide other supports for me financially and also just it would open the door for other supports that don't exist right now.
Right.
Because right now, technically, she isn't intellectually disabled. They say she has an exceptionality in these areas, but they won't go so far as to say she's intellectually disabled. And of course, how can you say that about a 7-year-old? You can't.
Right. Right.
But now she's a teenager. Now, there's been a lot of growth.
Yeah.
I think it's time to go back and retest. And of course, they're expensive, and so the board is pushing back and doesn't want to do it. And I can't afford to get it done on my own. So it's fun. Like I said, it's just
Yeah,
so much fun.
absolutely. But that's the thing, Elaine, is you're saying, right? I like to really pay attention to language, and you're saying that, okay, well, some weeks I do better than others. Some, that's a weakness of mine that I don't like. I'm not on top of it basically 24/7. And I'm wondering, is that really a weakness of yours, Elaine, or is this, a systems issue? Of course, this is big, right? But obviously the education system, but also the supports and even just the way we view and support or not support families who have disabilities, right? Like where people in the family have disabilities, whether it's the parent, the kids, with everyone or whatever that looks like.
I would like to say that it's a systems issue, but I think it's both. I personally I view it as a weakness because I see other parents, and I
Mhm.
know we're not supposed to compare, but
Right.
I see other parents like my parenting friend who I told you who she basically helps to run a farm and then she homeschools and then she has 4 kids.
Right.
So, I look at her and I go, she's on top of this and that and the other thing. Why can't I? Or I see other parents who work full time and they're, very engaged in their kids and they're able to do it. So I do see it as a weakness for myself because it's like, why am I not doing better? But you're probably right. Because I'm also very hard on myself and I expect a lot. And I always have. Like I said, it's that idea that I'm not okay with being okay at something. I have to be really good at it. So again, and that also, seeps into my parenting with the way, and definitely a lot more with my son when they're younger than when they're older, in the sense, what I mean by that is having a disability like blindness forces you to realize that everybody will scrutinize your child, and then once they find out that you're blind, they will put it through that lens. So I always never wanted my children to be, I never wanted them to be labeled as, oh, that's why they're wearing mismatched clothes, that's why their face is dirty, that's why they're, this way, because they have a blind parent, she doesn't see. I never wanted my kids to be that way. So especially when they were young, like my son, every day I dress him. He's allowed to pick his clothes, but they have to be clean. And he's got, I wash his face. And by wash his face, I don't just mean like I let him do it. I wash his face, like I touch it and I feel it. And I check for boogers and I check for toothpaste in the corner of his mouth. Or, he's not allowed to brush his teeth with his new clothes on because I don't want him to accidentally get spots of toothpaste or water on his shirt. And so I'm appearances, it's unfortunate because even though I'm blind, appearances are very important to me. And the idea that my children go to school and they're wearing clothes that are clean and their faces are washed and their hair is brushed. Now, my teenager, I can't say that I'm quite as picky with appearances because I let her do a lot more of that. Obviously, the hygiene is not the same. I'm not feeling her face. I will sometimes check her hair to see if she's brushed it. But most of the time, obviously, I don't invade her personal space that way. But I do try to remind her of things like, what she should be wearing, and reminding her of, we don't wear pajama type things that let our belly hang out, and that, we don't go to school without a bra, things like that. But is appearances matter to sighted people. So obviously I've learned that they matter. And so again, even though she's older, it definitely makes me worry sometimes when, she's not doing well or she's whatever, because, the teachers will get this impression, oh, it's because her mom is blind and that's why she's not able to help her. And that's why she's not, doing whatever. And it's frustrating because, like I said, it's a lot easier to sort of assuage those fears when they're little and stuff is finite. But when they're a teenager and you can't as easily separate, okay, what is her responsibility and what is the parent's responsibility? That's the really frustrating part. And that's the other part that's really frustrating as a parent too, is so if I start helping her with her schoolwork, or I start doing, like during the pandemic, I did a lot more of her schoolwork than she did. And that isn't fair because that means that obviously my abilities are going to show differently than her abilities. And that's the really frustrating line that's hard to walk. And I keep saying that word, and I know that I could come up with a synonym. I just can't think of one. But definitely, how much can we do for our kids without doing too much for them, especially when it comes to school?
Right. And then how do our own experiences of, either how we were parented, how we exist in the world currently, how do they impact, our parenting, our ability to help our kids with whatever's going on. And like you said, that kind of, what do people think, right? And those judgments. And as you're talking, Elaine, about that and about, comparison, right? And everyone says the same thing, I know I'm not supposed to compare, but I'm going to compare anyway, right? And I think probably everyone listening to this can relate to that, that comparison. And yet, this is why I do the podcast, is because we all struggle. I don't care what you look like on Instagram or social media. I don't care what you look like to your neighbors or your friends or whatever. we all have our struggles, right? Someone's struggles might be smaller than ours. Someone's struggles might be bigger than ours. It doesn't mean our struggles are not valid, right?
Well, that's the really nice thing. And I've tried to keep that in perspective, but it's so hard because it's true. Just because a working parent is able to work. And so obviously financial things, well, I mean, financial struggles are almost always an issue, but maybe it's not their primary issue. The idea of, okay, so I need to buy the groceries for the week. I don't have the money for it. Um, but again, a working parent struggles then the idea of, do they feel disengaged from their children where it's like, I don't get to spend enough time with them. I don't get to see them enough. And I see that with parents and dual parent families. I know a couple right now who they have one child and she's pregnant. And definitely I know that that's an issue because he's a bus driver and she works a nine, like an 8 to 6 job. And they feel like they don't get to see their kids enough. And it's sad that that is their struggle, even though to me that's sort of one of those things where I almost wish I was in a situation where I was working. Not because I don't want to see my kids, but just because I feel like then I would have a purpose. That's the other thing that's really interesting about parenting in general is that was something I really had to come to terms with. And it's the idea that it's okay that I'm just a parent and that there's no shame in it because our society has somehow diluted the idea of work to being a 9 to 5 or a night shift
Or
um,
being paid.
or being paid. And the idea that not being paid, even whether it's volunteering or whether it's being a parent,
Yep.
is acceptable and is okay. And that's what's really frustrating because I do a lot of online surveys most of the time just for supplemental income and just for also they help to, you know, feed my habit of loving takeout. so um, so anyways, I do a lot of online surveys. And of course, one of the demographic questions is always, are you employed? And their version of employed is usually full-time, part-time, student, homemaker, not employed. Very rarely do they have other options like disabled or employed for non-pay or, volunteering or et cetera, et cetera. It's very, we are, a society that has decided that work means paid. So if you're not getting paid, then obviously you're not working. And so parenting, obviously there's, your kids are not making money for you. So
I wish
yeah,
they did.
yeah, I wish they did too. It
Yeah.
would be hilarious, but
Yeah.
no, since your kids are not making money for you, it's you're not being paid for. And I really had it in my mind when I was young that I was going to be this, hardworking person. And if I ever do get a job, obviously I will be. But I had this view that I was a hardworking person and people would see me as prestigious based on the fact that I had a job and that I was really good at my job and I was hoping to get a prestigious job like something like being a lawyer or something that would be relatively good paying, so financial security wouldn't be an issue for me. And of course that was not the way my life unfolded at all. And definitely my best friend who I love very much, so it's funny because she looks at me and she says, you have your kids and I have a job, yeah. And I that's what we talk about all the time is I say, well, you have a job, you're getting paid. And she goes, yeah, but I don't have kids and I want kids. And she does. She wants children. And it's like, but you have the career. So it's like, well, can we somehow try to put these things together? And I always joke with her and I always say, well, you can have my kids. I'll take your job. And she's like, but I love my job. And I know she does. And that's the thing. But again, so it's dependent on what a person wants. But somehow we've decided it's judged on whether we're being paid for it or not. And so I've decided that I want to be a good parent, like I do. And that's part of the reason I haven't gone back to school and that I haven't really pushed for any employment that I possibly could get. I am restrictive in what type of employment I want. So it's because I've decided that being an active parent and being a good parent is something that I want to be able to look at. I don't want to be working the night shift and then my kids going to, those are all other hurdles that I wouldn't want to have to deal with. The fact that I never get to see them off to school, or the fact that I never get to make sure that their lunch is packed right, or, things like that.
Yeah.
So, but it's something that I still struggle with, because part of me says, if you had been a little smarter and made better choices, maybe you could have been that career woman that you wanted to be. So
Mm,
I have to remind myself all the time that it is acceptable to be a parent, and there is no shame in it.
no.
And anyone who makes you feel that way obviously doesn't understand what you're really going through. And that's the thing that I've realized too, is that my view of what a person perceives me as is often skewed by my own bias. And so I might look, someone who works and sees me as this amazing parent and thinks that I'm so engaged and does such a great job, doesn't see me as this person who doesn't work or
Right.
is a layabout or lazy.
Right.
Even though in my mind, that is what I think they perceive me as.
That's right. And that's, you nailed it, right? Like, that's why the comparison and the, worrying about what other people think, of course, like we do that. And of course, it's important because that's also a survival skill, right? If we stay with the pack, we'll survive, right? But it gets skewed now in like modern day, right? And those systems, right? We live in a capitalist society where making money is the main goal. And so being a parent and, taking care of your kids, raising your kids, all that stuff is unpaid work. So it's not valued. And, you're saying like, I don't work and all this stuff. And I'm like, oh my gosh, you're doing so many things, right? Like all your
That's what everybody
volunteering.
says. Yep.
Yeah, exactly. And I don't mean to like, cheerlead you or like, yeah, go Elaine, you're awesome, you're doing all the things. But, I think it's just that, again, is this a you problem, or is it that society doesn't value the work you are doing?
I definitely think that's much more of the truth, because it is very true. When I talk to people who have stayed at home with their kids and who love it, and who have a love-hate relationship with it, where they love being a parent, but they also hate, the struggles that it entails. But it's no different actually than someone who is working for paid work, because my bestie and I talk all the time about the things she hates, because she loves her job but she hates the bureaucracy of it, and hates the complications that management puts in for her, but she actually does love the work. So it's similar to parenting in that people who try to be the best that they can be for their kids, and are raising these individuals who obviously come from loving, supportive homes, which is basically all you can ask for. It doesn't mean that the home should look a certain way, or the family unit should look this way, or be a specific uh, should fall into a specific category. But basically, if your child is coming from a loving, supportive home and is able to coexist with other children, then you've done a good job at what you needed to do to be a parent and provider. And unfortunately, that work is not valued. And of course, it's added with the gender role of being a female, and the fact that I want to be more than just a mom, because some people expect that. It's not surprised that I'm staying at home and I'm a mom, but um, because I'm a single parent and I'm doing it all. I wish I was also a breadwinner and a parent, but again, I don't even know how that would look in my particular way, just because of the nature of my personality. Like, I worry that if I was to work, what would I miss out on? What would start to fall by the wayside with my kids that might go unnoticed, or that I might not be quite as attuned to. So I have a love-hate relationship with parenting and work, because I am grateful that I do have the time that I have, because I definitely think that if I was working, I wouldn't. And so certain things that I do take for granted now, like the ability to pack their lunch, the ability to check my son before he goes to school, the ability to take him off the bus and to put them on the bus, and to see his attitude and that sort of stuff. I don't want that to fall to somebody else. But at the same time, if I was working for some reason, I can rationalize it as being, that's okay.
Right. Because I'm getting paid. I'm making
Yes.
money. Yes. Yeah,
Yep.
exactly. Elaine, I feel like we could really, do a deep dive in all of these systems issues, which I love doing. And I'm just wondering, to wrap up, what would I tend to ask this question a lot, and it's a big question and it's a broad question, and obviously everyone's different, but what would you like to see more of in the realm of support or understanding in terms of being a parent with a disability? And obviously, I will say being a parent who is blind, in particular, not every disability is the same, obviously.
Well, I would say that I think that being a parent with a disability, it's nice when you can find a community of like-minded individuals to talk to you about parenting hacks and to talk to you about how it feels. And I think for me, unfortunately, I've found a few different communities, but I do find that there's not a lot of resources out there for parenting with a disability. There's lots of resources out there for children with disabilities or parenting a child with a disability, but I find that the resources for caregivers who have disabilities is limited. I also find, for me, especially because I'm a single parent, that is a layer that I wish that was catered to a little bit more. Because a lot of the times when I look at parenting with disability resources, a lot of the time it's usually one caregiver has a disability and the other caregiver doesn't. And it's in a dual parent family. Whereas actually, in my case with my son, both of us have disabilities. And so it would be nice to find more resources that way. And I mean, I am trying to push for this with CNIB in the sense that part of my role volunteering for CNIB is trying to inform their strategic moves for the next few years. And definitely my goal is to push for this idea that we shouldn't just be supporting the children who have blindness or low vision. We should be supporting the caregivers who have blindness and low vision by connecting them to resources available to them.
And then also us, like, putting those resources, not you and me, but like, those resources being put in place too, like existing.
Yeah.
Yeah.
I will say that another resource that I recommend that other people look to is the Healthy Babies, Healthy Children program that Ontario does have. It was something I used in both cases for my children. And it was very helpful especially in that beginning, because it provided me with a public health nurse who used to actually come and help me with things like the nipping milestones and also with weight and stuff in that first little bit, also lactation support. So definitely I recommend that program to anybody. I was really glad that it existed. In fact, with my second child, I got moved out of the program a lot earlier because literally it was kind of neat actually. I got to work with the same person for both of my kids because she was still working. And because I stayed in the same region, so I was able to work with them. And basically the second time around, she said, look, you don't need to be in this program. You know what you're doing. And that was really nice to hear. And I said, well, if you're really sure. And she said, no, you're doing okay. And these are the resources. Basically, it's not like you're an inpatient when you're in this program, but you are seen, like somebody comes to your house, right, to talk to you.
I use them too for lactation consult or support, with my first and my third, I think. And yeah, like it was great that they came to the house, especially when you have a newborn and you're like,
Yep.
leaving the house
Freaking
feels like
out.
a
Yeah.
whole ordeal. Like, oh my God,
Yep.
like, and the baby's not feeding and all the things, right? Absolutely. Yeah. So, reaching out to those supports and, if they call you, I don't know if they still do, but when I had my kids, like they would call after you have the baby and then say, do you want
Yep.
support? Yeah.
Do you want support? Yep.
Yeah.
And
And
then they
then,
sort of provide it on an on-demand basis, which is
yes.
great.
Yeah.
But like the second time around, basically, I was, they said, because a lot of the things I asked for the first time obviously was questions about how do I feed my baby? What do I feed my baby? And of course, they had all sorts of resources, and they would help me go through the nipping milestones. But when my son was born, and he was doing obviously fine with all of that. They basically said, you've been through this. And, because they would come in and I would tell them what was going on. And they're like, you're doing my job. So they said, would you be willing to give your spot to a mom who really might need it? And I said, yeah, for sure. And also they provided me with community resources that didn't do exactly what they did, but still did some of the overlap. So they said, if you're still struggling or if you're worried about things, here are resources that you can use. And they made sure to connect me with the community resources. And that's the great thing about public health, right? Is because it serves the community that they are in, which means they're going to know about what resources exist for that community. And in my case, that would be Marymount Crisis and Support. And that was like invaluable. That was the best resource they ever got on board with me. And obviously they have access to resources. So networking is definitely an issue, like something. And something that even sighted people don't have any idea about. Like when you mention HBHC to normal people, like not normal, but able-bodied people, they look at you and they go, this exists? I didn't know this exists. And that's the thing. And so it shouldn't be just for parents who are blind, but also for everybody. And I'm glad that it is. But the cool thing is again, I didn't encounter people in that program who assumed that I couldn't do it. They did whatever they could to make sure that I could do it. And were quite impressed by how I was able to do things. And the one nice thing that I will say that I've done over the years by interacting with CAS, by interacting with public health, is I've proved to them that it is possible. And I've opened their eyes to the idea that if they ever see someone else, they might not have those biases. And they might go, well, I knew this other person who did this. So obviously this other person, will figure it out.
Yeah. Yeah. And hopefully changing their approach, like asking, instead of assuming, right?
Back to what you were saying though about, what would I envision or what would I like to see more for parents with a disability? Definitely, like I said, more support groups based on the community that you live in. Because the one thing that I will say for parenting with the disabilities, there are support groups that exist, but a lot of them are global. And so they encompass, it could be around the world, whether it's Facebook or whether it's a group in one community, but there isn't groups in other communities. I would also say that networking with those parenting with the disability groups, along with groups that already exist in the resource, like La Leche League is a perfect example, because they're a great group, but you have to find the right facilitator who's willing to be open-minded to the idea of someone who's got a disability. But the reason that having specialized support groups for a particular disability is important is because some of the things that you will mention at a support group, a parenting support group, are not going to be at all the same things that another parent will encounter. And a lot of the times they'll think that you're just whining about something when, you talk about, oh, it was so frustrating getting on a bus today. And someone looked at my baby and told me, they gave me unwanted attention, and they gave me, they told me they'd pray over me, and they told me whatever. You look at them and normal able-bodied parents will look at you and go, well, they were just being supportive or helpful, or that was really kind of them. Whereas when you are someone who's lived with a disability like mine your whole life, and you get that kind of attention all the time, and you're a parent and you're adding to that, it's going to be something you're going to be upset about or be annoyed about. It's not going to be something you embrace. Whereas obviously, if you're not used to it, you would think that it is supportive, especially if your own perception of disability is such that we need to be pitied or prayed over or changed. And so definitely, yeah, having community-based supports for parents with a disability is something that it would be nice to see. And that could be, something like CNIB running parenting support groups. That could be like public health having a branch that caters strictly to people with disabilities, parents with disabilities. Because in my next workshop that I'm literally going to in a little bit is a parenting with a disability workshop, and it's a professor who they're teaching nursing students and other healthcare professional students about parenting with a disability and trying to open their eyes to the idea that it is possible. And the one thing that was interesting is she showed a video about rates of pregnancies to people with disabilities. And apparently, those rates are actually pretty much similar to rates of non-disabled people.
And there's so much like stigma and misinformation, like that people think that people with disabilities don't have kids, don't want them, or shouldn't have kids, which is just completely wrong and terrible on so many levels. And, so it's sad that we're still at that place that education needs to happen, but I'm glad to hear that education is happening, which is great. And Elaine, I just want to thank you so much for coming on and talking about your experience with parenting and coming into parenting. And I appreciate you so much. And I will put in the show notes all of those great resources that you mentioned. And yeah, I just really appreciate you having you on. Thank you so much.
Well, again, thank you for having me. I love sharing my story, and I really hope that to the people who are listening that it resonates with somebody.
Yes.
So
yes, absolutely. I'm sure it will. Thank you. Thank you so much for listening to this episode. Please share this podcast with any of your friends or family members that you feel would benefit from it. If you feel you are experiencing any of the symptoms or issues we talked about today, please reach out to one of your supports or go to perinatalwellbeing.ca for more information, podcast episodes, blog posts, and ways to connect with us. Check out our new podcast episode every other Wednesday.